It's still not clear if South Africa will be hit by the sixth COVID wave. In the past week, the National Institute for Communicable Diseases reported over 1,400 cases. Gauteng and the Western Cape recording the highest weekly incidence risk. Joining us now to give us a sense of where we are with COVID-19 cases is Professor Shabir Madhi, Professor of Vaccinology at Wits University. Prof, good to talk to you. Thank you very much for your time. How concerned should we be about yet another wave of COVID-19 infections?
Good morning. Thank you for having me. So the short answer is that COVID-19 hasn't really ever gone away since it started, and it's unlikely to disappear. We're always going to have low circulation of the virus. The recent information that's been sort of published by the NICD really represents the tip of the iceberg, and it's extremely difficult to make any head-to-head comparisons with the numbers that are currently recorded compared with what was previously reported. The reason for that is that there's been substantial differences in terms of the amount of testing that's been done, and the amount of testing that's been done nowadays is substantially lower than a year ago, as an example. And the testing has become much more focused on people that are ending up in hospital. So although these numbers do show an increase, it's an increase that's coming off a very low base to start off with. And yes, we likely will have another resurgence, probably sometime in October. But even when there is another resurgence, fortunately in South Africa at this point in time, that resurgence is unlikely to be any more severe than a fifth wave, which itself was relatively modest compared to what we had experienced earlier.
Yeah. Prof, you talk about people landing up in hospital as a result of the latest infections. So are you able to give us a sense of the hospitalization rate, and could there be a new variant that's driving these infections?
Yeah, so we don't really have, right now, the hospitalization there is an uptick in hospitalization, but nothing substantial. So certainly we don't have large numbers of hospitalizations taking place. I don't have absolute numbers, but what the NICD is reporting is largely probably hospitalization rather than mild infection, because as I said, there has been a change in terms of the practice of who is being tested, and it is primarily focused on hospitalized cases, especially in the public sector now. So there's a slight uptick, but nothing to be of concern as yet, and unlikely to be anything large compared with what we experienced in the past. Is there a new variant? So what has happened globally is that much of the virus that's currently circulating is sort of a different variation of what was previously referred to as Omicron, which was first identified in Southern Africa in November of last year, as you might recall. And subsequently, that variant has undergone further mutations or different sort of mutations, which what we refer to as sublineages. Now, what's really important is that a high percentage of people in South Africa, probably closer to 2/3, were infected with the initial Omicron variant. And they have developed immunity which protects them against severe disease, although it doesn't work too well in protecting against mild infection due to the sublineages. So there isn't a completely new variant that's circulating, but sort of modifications of the parent Omicron variant.
Prof, recently there has been concern over vaccine safety, and I imagine at this time it's probably one of those instances where we're going to be told that go and get your booster shots. How do you think this message is going to land this time around, given those safety concerns?
Yeah, look, the safety concerns will always be there, not just for COVID-19 vaccine, but for any other vaccine. All vaccines do have a nominal risk of serious side effects. In South Africa, as you know, there's been a single case that's been reported of an individual that possibly demised because of having been vaccinated. But that one case is in the context of 40 million doses of vaccines having been administered. So there is this low risk of developing a severe side effect. But at the end of the day, the risk-benefit ratio clearly is in favor of benefit for people to be vaccinated. And particularly people above the age of 50 and those with underlying medical conditions. If they're not coming forward to be vaccinated, if they're not coming forward to be boosted, to get additional doses of vaccine, some of them need 3-4 doses of vaccine, they're gambling with their own lives eventually. So yes, the risk of developing severe disease for anyone that's vaccinated has been substantially reduced, but people with underlying medical conditions still have some residual risk, and they can benefit from those additional doses of vaccine. At the population level in South Africa, although only 1/3 of individuals have received at least a single dose of vaccine, more than 90% have now developed immunity from infection. And what the science tells us is that when you combine infection with vaccine, what we refer to as hybrid immunity, that gives you the most potent form of protection, not only against severe disease, but also against being infected with the virus. So there's still a very strong role, a strong reason why people need to be vaccinated, and especially high-risk individuals. They need to be getting the 3rd and 4th doses of vaccine by now.
Prof, I'm terrible with statistics, and so I'm going to ask you for a much clearer response here. You're saying 1/3 of the population has been fully vaccinated. What does that tell us in terms of the entire population size of South Africa? I think we're about 60 million South Africans. Out of that, what are you saying in terms of 1/3 of the population that has been vaccinated?
Yes, it's about 20 million people that have received at least a single dose of vaccine, and that is not fully vaccinated. So 20 million people have received at least a single dose of vaccine. About 50 to 60% of those have received a second dose of vaccine. And in fact, very few people have received 3 doses of vaccine. So the term fully vaccinated is really incorrect. It's the number of doses of vaccine that an individual receives, which we need to benchmark against. South Africa's vaccine rollout, for all intents and purposes, has been dismal compared to other upper middle income countries, which South Africa is in terms of our GDP. When it comes to vaccine coverage, we have really struggled. And unfortunately, there were a number of missteps at the initial phase of rollout of vaccine, including the delay in terms of getting vaccines when it was required most. But that being said, there's still an important role for vaccines, and high-risk individuals in particular strongly urge that they come forward to receive those additional doses of vaccine to protect them from being hospitalized and possibly dying from COVID.
Sure. Prof, it's very clear that we are struggling as a country in terms of vaccine hesitancy. But again, I put it to you that we probably are going to struggle even more, and that prompts the question around the safety of that J&J vaccine. How safe is it right now?
But, like I said, there's been a single case of a fatal event that's been reported due to the J&J vaccine. And I think the number of doses of J&J vaccine that's been used in South Africa is about 10 million now. So it's a single case, unfortunate case, but it's the reality of all vaccines and not just COVID-19 vaccines. Vaccines remain safe. And especially when you look at high-risk individuals, again, to emphasize the benefit of being vaccinated far exceeds the really low risk of developing a serious side effect from vaccination. When it comes to children, we can have the discussion. The safety of vaccine in children and the benefit-risk ratio is a completely different calculation in children under 12 months of age, especially for the current generation of vaccines that don't protect too well in being protected against being infected. So that's a different discussion. But for high-risk individuals, again, to emphasize the risk-benefit ratio is clearly in favor of people getting vaccinated.
Professor Shabir Madhi, let's leave the conversation there. Thank you very much for your insights here. Professor of Vaccinology at Wits University.